Well, when Risa asked me to give some reflections, she really wanted me to cover some of these definitions that you've already heard a little bit today, but to make sure that we're sort of have a shared understanding as we go into this day. And so for me, this definition of equality versus equity, this visual here, I'm sure many of you have seen, but some of you may not. This visual has really been the most effective visual that I've seen. And you can see on your left, equality means to treat in exactly the same way, where equity means to treat fairly. And this is really a beautiful visual, I think. The little guy finally gets his 2 boosters up to see the game. And the tall guy really doesn't need the booster. And so when we talk about the words like disparities and inequality and inequity, disparity and equality implies differences between individuals or populations, so unequal. Inequity refers to differences that are unfair, unjust, and avoidable. And when we put those definitions, and add a health lens to that, it differentiates inequity and disparity and really brings injustice to light. So a health disparity, a population-specific difference in the presence of disease, health outcomes, or access to health care. And a disparity could be, adults versus children. More adults die over 70 years old than children do under 10. But when you talk about health inequity, again, unfair, unjust, and avoidable, an example from our region is Hispanic teenage girls are 6 times more likely to have a baby as white teenage girls. That is a health inequity. And when we focus on health equity, I took this definition, I don't know how many of you were at the Mass Public Health Association annual meeting on Wednesday, but Dr. Kamara Jones shared, health equity is the assurance of the condition for optimal health for all people. And working together to advance health equity will eliminate health inequities that, again, are unfair, unjust, and avoidable. So what extra resources and supports do these Hispanic teenage girls need? That would be something to ask as we look through a health equity lens. So let's look at some data, how health inequities can play out, for example, in life expectancy. So African American girls can expect to live 4 years less than their white counterparts in Massachusetts. And an African American boy can expect to live 7 years less than his white counterparts. Now, why is that? Well, many of us believe that it is because of the inequitable distribution of resources in this country, and that in our country's beginning moment, we chose to use one group of people, African Americans, based on the color of their skin to benefit another group of people, whites. And for the 400-plus years that we implemented inequitable policies and practices, we now understand through data that our current health outcomes are manifestations of that inequitable system that is in play to this day. Now, as we continue to look at data, it's interesting when we compare the life expectancy of Hispanic men versus white men. And Hispanic men can expect to live 4 years longer than their white counterparts, and many people scratch their heads at what folks are calling Hispanic paradox. And there are hypotheses to why this is. Maybe they're recently immigrated, they have more family or community involvement. They surround themselves, with family and support systems more often than whites. But when you dig down a little bit deeper, as we must continue to dig deeper into data, we see that Hispanic infants and men ages 15 to 24 years old have slightly higher death rates than their white counterparts. So I just present that because we see data and we think we know the answer, but things are always a little bit more complicated than we think. And when we look at our data by county in our region, we can see a 2.5-year difference between those of us that live in Hampshire County. Well, actually, this is for boys. Boys in Hampshire County versus boys in Hampden County. And we know that zip codes are excellent determinants of health outcomes, and zip codes represent areas of opportunity and areas that have lacking in opportunity. So if we look at premature mortality rates by town in our Western Mass region, the number that you see in the box represents the amount of collective potential years of life lost per 100,000 people. And this type of breakdown really forces us to better understand our region. You might be seeing something here on the screen that you wouldn't have expected, or maybe this is exactly what you would have thought. But it forces us to maybe check our assumptions, correct myths, to get clarity on where and what resources really are needed to be invested and where they need to be invested in our region. As I reflect on my journey of health equity that myself and Partners for a Healthier Community have been working on since 2008, it is really embedded an understanding in me that both our minds and our hearts need to be fully engaged in this work. The county health rankings, which Rep. Vega just referenced, put out a nice visual that shows the breakdown of what types of health factors impact health outcomes the most, and Provost Newman was talking about this earlier. 70% of health factors include the physical environment and the social economic factors. So I don't know if you can see them, but it's kind of the bottom two-thirds. Only 30% of health outcomes is attributed to behavior. So if we look at social determinants and where they are and not well resourced in our region, it really helps us strategize better. So much of our work, many of us in this room, has been about addressing social determinants of health. Before that term was maybe coined, we knew in our hearts where the systems were at play that we needed to focus on. And we've also, many of us, been working hard to address racism. And we can intellectually understand the environments that the systems such as education and criminal justice and access to food and health care, et cetera, that either provide opportunities for people to live healthy or not. And much of the work that's going on in the region is really positive and is, in fact, addressing some of these social determinants and having really wonderful outputs and outcomes. And yet we know that working only from our mind will not overcome the inequities. Partners for a Healthier Community a couple of years ago was convening a group of folks in the Valley that were specifically working to overcome racism. And we presented this logic model to that group. And two very wise men said that day, Dr. Frank Robinson and Paul Robbins, the founders, two of the many founders of the Healing Racism Institute of Pioneer Valley, said, you know, Jessica, logic model's great. But really what I think is we all just need to get together for coffee. And of course, those of us that had worked on the logic model were like, what? Coffee? But what they meant was really to commit time to getting to know people that are different from you, that you think are different from you, or that you're told are different from you. And that made us take pause. And in 2013, Dr. David Williams came to Springfield, a native of South Africa and now a professor at Harvard School of Public Health. And he presented to a very large group of us about institutional racism and health outcomes. And what has always stuck in my head from his presentation was his statement around policymakers, and that often they make decisions regarding a group of people based on their level of sympathy and admiration, which is really about your heart, right? It's not really your head, it's your heart. And as we continue to work as a network on health equity, what would happen if we allowed ourselves to get to know people? What if we went out of our way to meet people who are different than we are, in a different town or region that we are more comfortable in? Connecting to one another, expanding our inner circles, crossing town and county lines, putting ourselves in places that we don't normally go, being open to friendship, and recognizing sameness. As I was thinking about this opportunity, I thought I would love to share these stories of people in Springfield and Holyoke that have been doing tremendous work. And what if we went out of our way to learn and get to know people, amazing adults and young people, that are so oftenly negatively depicted in the news in our region? This is Samari Cruz with her mentor, Milton White Jr., and Miguel Cruz with his mentor, Sasha Jimenez. And all of them working on issues together around discipline and confidence and advice and empowerment and determination. And Mark with his son Taj trying to eat healthy. And Veronica dancing with her friends. And Andy and Sum making a culturally delicious meal in their kitchen together as a family. When we work with our hearts and our minds, wouldn't we have more empathy and sympathy and admiration for others? Because we would have allowed ourselves to learn and experience that they are just like us. And we all basically want the same thing. So I am so excited for this day and grateful for Risa's leadership and everyone else to experience this summit with you. I know that you will all agree and affirm with me when I say to this girl and all the others like her that no way, not on our watch, are you going to lose 4 years. So I think we know what we need to do, and now it's time to just go out and do it. So thank you for coming today and listening to me and everyone else, and I look forward to changing the world with you in the future. Thank you.